let's have a short introduction about DSM. So, DSM stands for Diagnostic and Statistical Manual of Mental Disorders, and TR is text revision. This manual is published by American Psychiatric Association and used by mental health professionals to diagnose and classify mental disorders. The text revision TR version includes updated text, description, clarification, and new information based on recent research, while the diagnostic criteria largely remain the same. So here we have some notes. There is the first line written as like the DSM-5-TR text provides contextual information to aid in diagnostic decision making. This means that in addition to listing symptoms and diagnostic criteria, the manual includes important background detail such as cultural factors, age-related differences, gender variations, and environmental influences. By offering the broader perspective, the DSM-5-TR helps mental health professionals to understand the individual's condition in context, reducing the risk of misdiagnosis and improving treatment plannings. For example, behavior that may seem unusual in one culture might be completely normal in another. So, understanding the person's background is essential. One important thing is that DSM provides diagnostic criteria to identify mental disorders, but does not include treatment plans. So we have some definition discussed below that are also given in DSM-5-TR with each and every disorder that helps us to understand the disorders more accurately and helps us in diagnosis. So the first one is recording procedures. This means that this section tells us how to correctly write the disorder's name, pick the ICD-10-CM code, and apply any subtype or specifier. For example, if someone has a major depressive disorder with recurrent and moderate specifier, then we will write it as major depressive disorder recurrent moderate with code F33.1 that shows the moderate, F32.1 that shows the moderate level of the disorder. Then we have subtype or specifiers. These are the extra details that describe different forms of the disorder. For example, if person is diagnosed with ADHD, then subtypes or specifier will help us to understand the person have ADHD of what type: inattentive type, hyperactive type, impulsive type, or combined type. Then the third one is diagnostic features. This section explains the main symptoms and how to understand them properly. For example, in schizophrenia, some people may look like they have negative symptoms, like lack of emotions, but those might be due to medication side effect that could not be considered as disorder itself. If the person have symptoms that shows schizophrenia, then it is necessary that it do not have any um, medication induced symptoms. Then we have associated features. It means that these are common symptoms seen in people with the disorder, but they are not required for diagnosis. For example, in generalized anxiety disorder, people often also have headaches or stomach aches, but even though those symptoms are not listed in main criteria. Then we have prevalence. Prevalence means that how common the disorder is in different groups: age, gender, culture, or location. For example, major depression is more common in women than men. It may affect around 7% of adults in a year in the US. Then there is development and course. This explains when the disorder usually starts, how it changes over time, and what the typical pattern looks like. For example, bipolar disorder often begins in the late teens or early 20s, and it may come and go episodes and not stay the same all the time. Then we have risk and prognostic factors. These are things that can increase the risk of getting the disorder or affect its outcomes. For example, such as temperamental factors tells us how traits can increase risk of getting mental disorders. And in culture related diagnostic issues, means that cultural background can affect how symptoms appears, what people believe caused them, and how common the disorder is in a group. For example, in some cultures hearing voices might be seen as a spiritual, not a sign of schizophrenia. And also, in if we try to add something in recording procedure, so we can add this as an example, like disorders will be recorded according to the diagnostic criteria using the appropriate ICD-10 code, subtype if any subtype is, and a specifier if any specifier is applicable. For instance, and also the DSM diagnostic criteria and text are primarily designed to assist clinician in conducting clinical assessment, case formulation, and treatment planning. DSM-5 is also used as a reference for the courts and attorneys in assessing the legal consequences of mental disorders.